Welcome to the Ryan White Planning Council first public hearing for 2022. The public hearing was pre-recorded online through Zoom. If you would like a copy of the information being presented this evening, you can view and download the documents from our website, arawpchouston.org. I am Janet Deal, Vice Chair of the Effective Community Committee of the Ryan White Planning Council. Also with us this evening is the Chair of the Ryan White Planning Council, Crystal Starr. Co-Chair and Vice Chair of the Quality Improvement Committee, Dennis Kelly and Kevin Alavis. And Tori Williams, liaison to the County Judge, Lena Hergo. The focus of tonight's public hearing is the recommended changes to the service funded by Ryan White, Part A, Part B, and the state services for the fiscal year 2023, which will begin on March the 1st, 2023. But first, there will be a presentation on Project LEAP by Tori Williams, who is one of the facilitators of the program. Afterwards, Kevin will explain Quality Improvement Committee, how to best meet the needs process, and then Dennis will present the committee's recommendations for HIV medicine support service funded by Ryan White that are currently provided in Harris County and surrounding areas. Remember that everything discussed here will not be affected how service are delivered now, but will impact how service will be delivered approximately 10 months from now in the year 2023. After the presentation, I will explain how you can give public comments regarding the information presented. At this time, I would like to turn the meeting over to the chair of the Ryan White Planning Council, Crystal Starr, who will describe the role of the Planning Council and the purpose of this public hearing.
Thank you, Johnny, for the informative introduction. Good evening, everyone. I am Crystal Starr, Chair of the Houston Ryan White Planning Council. I am pleased to welcome you to our public hearing. I will briefly describe the history of the Planning Council and what we do and why we are here tonight. The Ryan White program is the largest federally program focused exclusively on providing care for people who do not have sufficient health care coverage or the financial resources for meeting the challenges of living with HIV. Ryan White fills the gap in care that are not only covered by other sources. The Ryan White HIV/AIDS Treatment Extension Act of 2009 was first enacted in 1990 as the Ryan White Care Act and has been amended and reauthorized 4 times in 1996, 2000, 2006, and 2009, adjusting with each reauthorization to accommodate new and emerging needs, such as an increased emphasis on providing life-saving and life-extending medical services for people living with HIV. The Ryan White program works with government entities and community-based organizations to provide HIV-related services to more than 500,000 people each year. There are several parts within the Ryan White program, each one designed to meet the needs of different communities and populations affected by HIV. Part A funds are designed to serve metropolitan areas and are awarded to the chief elected official primary responsible for providing HIV care in the geographic area. In the Houston eligible metropolitan area, that person is the county judge, Lynn Hidalgo. In 2021, Harris County received over $26 million to provide services for people living with HIV in the 6 county areas, which include Harris County, Fort Bend County, Liberty County, Chambers County, Waller, and Montgomery counties. In 2007, the state asked the Houston Ryan White Planning Council to make recommendations for Part B and state service funds. Part B funds are awarded directly to the state of Texas and are used to provide care for people with HIV in a 10-county area, which includes the 6 counties previously named, plus Austin, Colorado, Walker, and Warden counties. In fiscal year 2021, Ryan White Part A, Part B, and state service dollars totaled over $30 million. Again, Congress requires that most of these funds be used to provide medical services for people living with HIV in the 10-county area. Currently, approximately half of the 30,000 people living with HIV in our area are using a Ryan White funded service. By law, the council is responsible for determining the number of individuals in our area who are living with HIV, assessing the needs of the HIV community, establishing a comprehensive service plan, setting service priorities and allocating funds, assuring that services are sufficient to meet the future needs of the changing epidemic, and assuring that appropriate services are available to meet the needs of the unserved, the underserved, women, infant, children, and youth. Ensuring access to services for those who need substance use disorder treatment, and assessing an administrative mechanism which procures services and disperses funds. The Planning Council falls under the Texas Open Meetings Act, and its processes are open to the public at all levels. We strongly encourage participation by all members of the community and take public comment and input very seriously. The council is currently holding meetings in a hybrid format, which gives you the option of attending in person or virtually. The council meets on the second Thursday of every month at noon. For more information, call the Ryan White Office of Support at 832-927-7926 or visit the website at rwpchouston.org. This information will be repeated for you at the end of the program. It is important to remember that Ryan White funds are the funds of last resort. This means that all other resources for an individual must be exhausted or unavailable before Ryan White funds can be used. For example, a person must use their private insurance, Medicaid, or Medicare benefits before they are eligible to have Ryan White monies paid for primary medical care. These are also income eligibility requirements that govern the use of Ryan White funds. Many of the services that we provide have an income cap of 300% of the current federal poverty guidelines, which means that an individual with a yearly income of $40,770 or less will be eligible for assistance provided all other avenues of coverage have been exhausted. The same guidelines applies to a single parent with one child would be $54,930 or less. The service categories to be reviewed this evening include those that are funded by the Ryan White Part A, Part B, and state services. Examples of some of the services which the Ryan White program funds are allowed to provide include outpatient primary medical care, medication, oral health care, mental health services, and assistance with health insurance premiums, copays, and deductibles. The purpose of tonight's program is to inform the public of recommended changes to the local service category definition in order to get feedback from consumers of Ryan White funded services and others as to how the recommended changes will affect their ability to receive medical care and supportive services. Community input is not only necessary, it is vital to all planning council processes and is encouraged at every level. At this time, I would like to introduce you to our next speaker, Tori Williams, Director of the Office of Support and Liaison for County Judge Lynn Hidalgo to the Ryan White Program. She will present information on the Planning Council's training program, Project LEAP.
Thank you, Crystal. Hello, I want to talk with you about an educational opportunity for people who want to learn about the HIV prevention and care system in the greater Houston area. The name of the program is Project LEAP, which stands for Learning, Empowerment, Advocacy, and Participation. Project LEAP is for people living with or affected by HIV. Classes start at the end of July and the program is free, but the expectation is that students participate in one class a week for 17 weeks and they come to class prepared to listen and engage with the presenters and with the other students. Project LEAP is unique to Houston and is only offered to 30 students once a year. The goal of the program is to provide skills so that graduates use these skills to become active and effective participants in local HIV planning groups, such as the Ryan White Planning Council or the Houston HIV Prevention Community Planning Group. Graduates help shape the future of HIV services in our community. Project LEAP was created because local planning groups need people living with HIV and others who are not afraid to speak up and advocate for the needs of consumers. After graduation, students feel more knowledgeable and confident as they work with doctors, social workers, consumers, and others to design services. If you are a person living with HIV, or you have a friend or family member that is challenged by HIV, you are a perfect candidate for the class. How does Project LEAP work? Classes are held on Wednesdays for 17 weeks. 15 students participate in the morning class, and 15 different students participate in the evening class. Classes are 4 hours in length and include hands-on activities, group projects, and field trips. Guest speakers are experts in their field and enjoy sharing new and updated information with students. What will I learn? As you can see from the long list on the screen, some of the topics covered in class include HIV 101, the history of HIV in the Houston area, tools for designing and funding services, leadership training, and more. Skills include meeting facilitation and Robert's Rules of Order. If you don't know what that is, we will teach you. You will also learn presentation skills, how to read and understand data, planning and evaluation skills, advocacy, and cultural competency. The facilitators provide information and handouts for each class. We have mock meetings with role playing, bring in expert speakers, There are hands-on activities, class projects, and again, several field trips to see what planning groups do when they meet. Those eligible to apply for Project LEAP are people who are living with HIV or are affected by HIV personally or professionally, and people who can meet the class expectations in terms of attendance and participation. What do you get out of Project LEAP? You get knowledge and skills that help you advocate for your health as well as the health of others. You get an extensive binder of information with easy to read materials about HIV, and you get access to experts and mentors, as well as some new friends who share your passion and concern for the issue. Most important of all, you get the opportunity to make a difference for people living with HIV. So how do you apply to be a Project LEAP student? You must submit a written application before July 1st. We will call and set up an interview, which can be in person or virtual, depending on your comfort level. The classes will be hybrid, so students can choose if they wish to participate in person or virtually. Classes will begin on July 27th and end in mid-November. To find out more information or to apply, go to our website at rwpchouston.org or call us at 832-927-7926 or email diane.beck@cjo.hctx.net, and Diane will call you back. This contact information will be repeated at the end of the public hearing. So please call us or email us. We would love to hear from you. At this time, Kevin Aloysius, the Vice Chair of the Quality Improvement Committee, will explain the committee's function, and then Dennis Kelly, a 2016 graduate of Project LEAP and the co-chair for the Quality Improvement Committee, will describe recommended changes to the Ryan White funded services in 2023.
Thank you for the valuable information, Tori. Many current and former council members are graduates of the Project LEAP program and would agree that the training is very valuable for those who want to be involved in the planning process. The How to Best Meet the Need process has just been completed and is the focus of tonight's public hearing. Each of the Part A, Part B, and Texas Department of State Health Services funded service categories was reviewed during a series of work groups comprised of consumers, service providers, healthcare providers, and other community members. The work groups made recommendations for each of the local service definitions, and the Quality Improvement Committee met to review and approve those recommendations. All comments received from the community regarding the recommendations will be forwarded to the Quality Improvement Committee for consideration and added to the recommendations that will go to the Planning Council for final approval next month. A copy of all the service definitions, including recommendations from the work groups and Quality Improvement Committee, is available in the information packet, which is posted on our website, rwpchouston.org. I would also like to mention our use of the Federal Poverty Guidelines as eligibility criteria for Ryan White services. These guidelines are evaluated annually during the How to Best Meet the Need process. For most services, the financial eligibility is set at 300% of the federal poverty level. The Federal Poverty Guidelines for 2022 are as follows. For a single person, 300% of the federal poverty level is an annual income at or below $40,770. For a family of two, 300% of the poverty level is $54,930. And for a family of three, 300% of the poverty level is $69,090. For each additional family member, add $4,720. The same increment applies to smaller family sizes, as can be seen in the previous figures. According to the U.S. Department of Health and Human Services webpage, where the guidelines are located, they become effective on the day they are published. A copy of the 2022 Federal Poverty Guidelines is included in the information packet. At this time, Dennis Kelly, co-chair of the Quality Improvement Committee, will present the recommendations and describe changes to the service definitions for fiscal year 2023. Please note that the services discussed are for people who are living with HIV and meet the required eligibility guidelines.
Thank you, Kevin. I will now present the recommended changes to the service definition and eligibility guidelines for fiscal year 2023. The information packet for tonight's public hearing includes a copy of each of the service definition, along with the summary of the recommended changes for all service categories, the current financial eligibility for each service, as well as the suggested financial eligibility for fiscal year 2023. Is listed on the table of contents of the service definition packet. First, I will present the list of services for which no changes to the service definition or financial eligibility are recommended. Ambulatory outpatient medical care, including emergency financial assistance for pharmacy assistance and outreach, emergency financial assistance other, health insurance premium and cost sharing assistance, home and community-based health service, which is commonly known as the Adult Day Treatment Program, hospice service, logistics service, medical nutritional therapy and supplements, oral health care, both untargeted and targeting the northern rural area, outpatient substance abuse treatment, medical transportation, and vision care. The committee is recommending changes to the following services. Case management include medical, clinical, non-medical linkage, and non-medical targeting substance use disorder. It's recommended to the Priority and Allocation Committee to increase funding for all case management service, specifically to increase salaries to reduce staff turnover. And local pharmacy assistant program, which is known as LPAP. Increase the financial eligibility for non-HIV medication from 400 to 500% of the federal poverty level to be the same as for HIV medication. Early intervention service and referral for healthcare and support service. Transition the service definition for early intervention service for the incarcerated to referral for healthcare and support service to better align with the scope of services provided. Mental health service. Table approval of this service category to allow the committee more time to discuss the public comment received on May 3rd of 2022, which suggested adding psychiatric encounters to the mental health service category because they see people living with HIV who have been unable to access psychiatric service at the clinics because of wait lists and staff shortages. For more information about these suggested changes, please contact the Office of Support at 832-927-7926. I will now turn the floor back over to Johnny, who will explain the process for submitting public comment regarding the information presented at tonight's public hearing.
Thank you, Kevin and Dennis, and special thanks to the Quality Improvement Committee and How Best Meets the Needs work group participants for the hard work that they have put into this important process. After the hearing, the information presented this evening, you may want to give public comments to the Planning Council. The Planning Council falls under the Texas Open Meeting Act, and its processes are open to the public at all levels. We strongly encourage participation by all members of the community and take public comments and inputs very seriously. There are several options for you to provide public comments to the Planning Council. You are not required to give your name or your HIV status. To do so, you can email comments to Facebook Aura WPC at hctx.net. You can fax comments to 713-572-3740. You can phone in your comments to 832-927-7926. Or you can send your comments through our Facebook page, Aura WPC Houston. Comments must be received by our office before 9 a.m. Wednesday, May 25th. Comments will be forwarded to the Quality Improvement Committee for review and consideration. If significant comments relate to the service categories are received, the Quality Improvement Committee will meet virtually on May 25th to review the comments and consider making changes to the recommendation service definition. On June the 2nd and on June the 9th, the Steering Committee and Planning Council will review and vote on the FY 2023 service definition. You're welcome to attend any of the virtual meetings. Check your website calendar for instructions on how to participate by Zoom. This concludes the Ryan White Planning Council public hearing for 2022. I would like to thank everyone who viewed the program for participating in this important process. As stated earlier, the service category recommendation presented will not affect how service are delivered now, but will impact how service will be delivered approximately 10 months from now in the year 2023. The Ryan White Planning Councils meet on every second Thursday of every month at noon in a hybrid format, which gives you the options of attending in public or virtually. Please check the calendar on your website, aura.wpchouston.org, for the locations of the meeting and the Zoom link. Staff is working remotely, so please do not come to the office without calling to be sure we are open. To apply for Project LEAP, the free training program which looks at HIV prevention and care system in the greater Houston area. Please go to our website, aura.wpchouston.org, for a link to submit the applications online. Applications are due before July the 8th. This is a wonderful training experience, and I encourage everyone with the interest in HIV service to apply. Our next public hearing will be at 7 p.m. on Monday, June 27th. The topics to this presentation will include priority and allocations committee recommendations for the service category priorities, ranking and funding allocations for the fiscal year 2023. On behalf of Ryan White Planning Council, we thank you again for participating and have a good evening.